Hello, dear listener. Very good morning to you, and welcome to this edition of Perspectives, a current affairs discussion program on Agate Radio 95.5 Star FM, Makurdi, Benue State. Today's edition of Perspectives, our focus is on World Hypertension Day. The World Hypertension Day is observed annually on the 17th of May every year. Ahead of the day this year, this edition of Perspectives intends to give a spotlight on what the day is about. The main aim of the day, according to the World Hypertension League, is to educate the public and increase awareness on hypertension, which is also commonly known as high blood pressure. Hypertension is said to be a major cause of a range of health problems such as strokes, heart attacks, and kidney disease, and can also contribute to dementia. Many people who suffer from hypertension, according to research, are said not to be aware that they have it, and as it shows no symptoms, often people only find out after suffering a heart attack or a stroke. According to the World Hypertension League, which is an umbrella organization of 85 hypertension societies across the world, the focus of this day is intended to raise awareness on hypertension generally and other cardiovascular diseases. And back home here in Nigeria, the Nigerian Heart Foundation revealed that between 30 to 40% of Nigeria's over 200 million people lives with hypertension, also known as blood pressure. Commemorating the day last year, the statistics reveal that it is afflicting over 80 million residents, with more than 33.3% of Nigerian adults said to be hypertensive, and over 30% said not to be aware and not even accessing medication. How can this be curtailed, given that this is a rising phenomenon that is affecting the public health of Nigerians? This is why this edition of Perspectives gives a focus on this to sensitize the public and take care of this very serious ailment plaguing the society. Our discussant on the program is one of them, the head of Department Internal Medicine and a consultant cardiologist at the Federal Medical Center here in Makurdi, Dr. Patrick Idoko. Welcome to Agate Radio, Dr. Idoko.
Thank you very much for having me.
We also have a consultant family physician at the Benue State University Teaching Hospital, Dr. Grace Atokolo. Welcome to our studio, Dr. Atokolo.
Thank you. Thank you very much.
I am Nathaniel Nongu, your presenter on this program, dear listener. And if you are tuning in for the first time to Perspectives, be informed that it is an audience interactive engagement, which we allow you opportunity to phone in to contribute to the subject matter we are discussing. The program enjoys airtime from now to 11 a.m. and usually at 10 o'clock, we open the telephone line so you can call in and ask questions or even make contribution on the subject matter. And the number through which you can reach us once it is 10 o'clock, the line for calls is 0814-335-9292. The number once again is 0814-335-9292. That line is dedicated for calls, which we will start taking at 10 o'clock. You can also send us a message or a WhatsApp chat on 0912-699-9404. The line for text messages and WhatsApp contributions once again is 0912-699-9404. And if you are sending a message, kindly remember to include your name and the location you are sending the message from. Let's also inform you, dear listener, that you may listen to Perspectives on our website as it is streaming live there on www.agateradiotv.com. Once you log on the website, check the top right corner and you'll see a radio icon there. And if you click on it, you'll be sure to listen to us. We are also available on Radio Garden. If you have your Radio Garden device, Radio Garden app on any device at all, you'll be sure to access the listenership of Agate Radio, its programs, and every content of Agate Radio there. This program is also streaming live on all our social media platforms, including Facebook, YouTube, and Instagram. If you search Agate Radio and TV on these platforms out, you'll be sure to access this program and all other contents of this station. Our discussants are seated and we will begin the engagement. I'd like to begin with you, Dr. Idoko. World Hypertension Day. What is it about and what is hypertension?
Okay, good morning, everyone. It's a pleasure to always speak about this. It's something that I am very passionate about. Hypertension is a very important subject. It's the leading cause of death worldwide. So every year there are about 18 million deaths from cardiovascular diseases, and over 10 million of these deaths are directly related to hypertension or high blood pressure. So it's an important subject that cannot be overemphasized. Before now, hypertension was said not to be a problem around here, but now we just cannot keep quiet about it anymore. HIV/AIDS, I'm sure a lot of people speak about it. At the height of HIV/AIDS pandemic, it was killing about 2.2 million people every year. That's about the height. Now, very fewer than that die from HIV/AIDS, but people talk about it a lot. But then we have hypertension, which kills more than 10 million people every year, and we don't speak much about it. And it's killing people. I'm sure most people have heard of people who went to bed and didn't wake up, or they've heard of people who just went to the market and slumped, or in their office and they slumped. People who just see headache and they are gone. Or you see people with strokes, with kidney diseases and all that. So those are all consequences of hypertension. And we have to keep speaking out about hypertension. So it's a very important topic. So because of the epidemic we are having now of cardiovascular diseases led by hypertension, the World Hypertension League, the World Heart Federation, and all the important cardiovascular foundations came together to formulate this day, which is marked on the 17th of May every year, the World Hypertension Day. And every year there's a theme for the day to raise awareness about hypertension, to raise awareness about the diagnosis, detection, and treatment of hypertension so we can prevent the complications that arise from hypertension. So the theme for this year is Know Your Numbers. So what know your numbers? There are a lot of people that move around and ask them what's your blood pressure and they don't have an answer. Even doctors, even health workers, they don't know. But so it's important. This year we are trying to raise awareness that people should know their numbers. Know what is your blood pressure, what is your blood sugar, what is your weight, what is your BMI, what is your cholesterol levels. So you expand it that way. Just know your numbers. And when you know your numbers, when you know better, then you can act better. So what is hypertension or what is high blood pressure? Usually when you have elevated blood pressure on 2 or more occasions above the normal for the person's age and gender, then it's said to be high blood pressure. It's said to be hypertension. So normally, using the World Health criteria, there are 2 numbers when you are checking the blood pressure. There's a systolic blood pressure, which is the blood pressure up, if I have to use that term. And then there's a diastolic blood pressure, which is the blood pressure when the heart is relaxing, and then that number is down. So usually a blood pressure should be less than 140/90 millimeters of mercury. So when your blood pressure is persistently above or above 140/90, or the systolic is more than 140 and above, or the diastolic is 90 and above, then you are said to have hypertension or high blood pressure. There are different other bodies now that are pushing for blood pressure diagnosis or cutoff to be less than 140/90, because the American Heart Association, for example, is trying to use 130/85. Why are they using that? They're using that because they feel we are seeing people with stroke at 130 at less than 140, so why do we have to use that cutoff? But the European Society of Hypertension and then the World Health Organization is still using 140/90, and so that's the criteria we are using. So if your blood pressure is persistently elevated at 140 and above for systolic or 90 and above for diastolic, then you're said to have hypertension. And then we would have to act to prevent the complications of hypertension.
Okay, we'll dive into that as we go along. Dr. Atokolo, I am with you now. Also give us your insights on what the World Hypertension Day is all about.
The World Hypertension Day, as Dr. Idoko has rightly said, it's about the day that been set aside by all stakeholders managing hypertension to raise awareness on hypertension, also to enable early detection and treatment of hypertension. Okay. So the World Hypertension Day is usually celebrated on the 17th of May, as he has said, every year. And this year, the theme is Know Your Numbers. Know your numbers, very important. Most people do not know what their blood pressure is. They don't even know what their blood sugar levels are. They don't even know their height. They don't know their weight. So it's very important that your numbers, you know what your blood pressure is, so you can early detect if there is any, if the readings are not okay, you can quickly get treatment for that early.
Okay, Dr. Idoko, oftentimes we hear of these terms: hypertension, heart attack, cardiovascular disease, which to a layman may seem the same terms, maybe meaning different things, or meaning the same thing. Help us understand if there is any difference or similarities between these three components.
Yeah, so they are not the same, actually. So like we said earlier, why hypertension is sustained elevation of blood pressure. So what we call high BP. So your blood pressure is high, you have hypertension. So when you have hypertension, it might be affecting the heart, depending on how long it's been there and how high it is. When we have hypertension and it starts affecting your heart, then we call it hypertensive heart disease. So it means it's beginning to affect your heart. The heart is can start dilating or becoming bigger. The walls can start thickening. So changes, when it's affecting the heart, you have hypertensive heart disease. So somebody can have hypertension but not have hypertensive heart disease. So depending on if it started affecting the heart. So the high blood pressure is that the pressure in your blood vessels are elevated. Then when it starts affecting the heart, you have hypertensive heart disease. Now hypertensive heart disease can cause a number of other things. It can cause heart attack. Heart attack now medically it's called myocardial infarction. So what that means is that there is a part of the heart that is not getting enough blood. The blood is cut off. So you have that part not getting enough blood, and usually they can have chest pain, difficulty in breathing, sudden death, and all that. So that's heart attack in the late term. So it's a complication that can arise from hypertension or high blood pressure, but it's not synonymous with hypertension. And hypertension is not the only cause of heart attack, even though it's a leading cause in this environment. There are other causes: diabetes, high cholesterol levels, congenital issues, a number of other things, high substance abuse, and others can cause heart attack. So when you say cardiovascular disease, it's a broader term. Cardiovascular disease, cardio means heart, vascular means blood vessels. So what that means is that disease of the heart and blood vessels. That's what cardiovascular disease means, and it's a broad. It's a big set. So it includes stroke, anything that has to do with the heart or the blood vessels. So it includes stroke, it includes heart attack, which is myocardial infarction, it includes heart failure, it includes abnormal heartbeat. We call them arrhythmias, which people can, when you feel your heart beating. It includes peripheral artery disease, which is blockage of the arteries. It includes even kidney diseases, chronic kidney disease. Those are all cardiovascular diseases because they arise from disease of the heart or blood vessels. So that's like the big umbrella term. So when you talk about cardiovascular diseases, you're talking about a whole lot umbrella. So when you see I said cardiovascular diseases, there are 18.5 million deaths every year from cardiovascular diseases. But hypertension, there are about 10.9 million deaths directly related to hypertension every year. So they are all different terms. But the point it just makes is that we need to, there's an epidemic. It's a plague of our time, and we need to pay attention to it. There are 1.5 billion people that live with hypertension worldwide. So that's a whole lot. And 1 out of every 3 Nigerian adults has hypertension. But it's not all of them that have cardiovascular disease. It's not all of them that already have hypertensive heart disease. It's not all of them that have a heart attack. So I don't know if that clarifies a bit your question.
Okay, that is quite noted, Dr. Atokolo. When you mentioned the theme for this year, Know Your Numbers, the World Hypertension League had also declared measure your blood pressure accurately, control it, and live longer as the extended theme for the World Hypertension Day this year. Speak to us within the circumstance of this theme and how it should guide the public with regards to checking hypertension.
Yes, like as you said, know your numbers. Checking your blood pressure correctly,
Yes.
as I said, it will enable you to live healthy. And Dr. Idoko has said it's like an expansion of or continuation of what he has just said. Hypertension can cause a lot of problems, which from there you have other diseases like stroke, renal diseases, disease of the arteries, can affect the legs and other problems. So hypertension on its own doesn't really have problems. It is the complications, the things that it causes that makes hypertension very important. Because most people don't even know they have high blood pressure. So it's the thing that the hypertension can cause that makes hypertension a very important illness because of all the myriad of other diseases that arise from hypertension. That's why it's very important to know your numbers, your blood pressure. Measuring it correctly is also very important. There's several things that can also make someone to have elevated blood pressure, but not necessarily hypertension. People that are taking substances can have elevated blood pressure for a short period of time. And people that are taking other stimulants, even things like cola nuts, things like caffeine, they can have some elevated blood pressure for a short period of time. But when you measure your blood pressure correctly and consistently, that means that you have 2 readings of a high blood pressure. That is diagnostic of hypertension. And you have to start taking care of that through lifestyle modifications. That is addressing those factors in that person that can lead to that hypertension. And also taking up other lifestyle modifications to help prevent the progression of the hypertension to these other diseases that we have mentioned so far.
Okay, Dr. Idoko, is there something you would like to add to this before we go to look into other issues with regards to speaking to us in the context of this theme, broader thing, measure your blood pressure accurately, control it, live longer?
Well, that theme has been the theme for a number of years now.
Okay.
Yes, and I think that the reason why it's remained, it's because of the significance, it's because of the importance. That's why every year they keep repeating it. That's the know your numbers, measure your blood pressure accurately, live longer. It cannot be overemphasized. So the thing is that, like I said before, in the Middle Ages, in the Dark Ages, the leading cause of death, they had the bubonic plague then, which was ravaging the whole place and killing everybody. So that passed, and then we moved to infectious diseases, which used to be the leading cause of death around here. But now, epidemiologic transition, as they call it, as the society is developing, the pattern of diseases are changing. The causes of death are changing. At the height of the Roman Empire, I think it was war that was the leading cause of death. But now, infections are not so much a problem. So we have moved to non-communicable diseases. And most people that will die young, and the reason for this short life expectancy we have here, a lot of them now, it's non-communicable disease. So if you are able to address hypertension, which is a leading cause of cardiovascular death or the leading cause of death worldwide, then people will live longer. So that's why it cannot be overemphasized. If you know your blood pressure and you know that it's high, then you can do something about it. If you do something about it, then certainly you will live longer. So the message has not been passed enough because, like I said, 1.5 billion people live with hypertension. Only less than half are aware that they have hypertension. And of the half that are aware that they have hypertension, only less than half of them are on treatment. And of those that are on treatment, only, even in the best of centers in the world, only less than 20% have good control of their blood pressure. And when even if you are taking medications and your blood pressure is not controlled, you can still have a stroke and still have all the complications. So you see why knowing your number is very important. So you cannot just sit down, I don't feel anything, so I don't have to check. No, you have to know. Because you might not feel anything, it's a silent killer. I am already taking medication, so I don't have to know the number. You have to know, because I am taking medications does not insulate you from having complications if your blood pressure is not controlled. So knowing the number is very important. And I have a feeling that even next year, this will be the broader theme. Know your numbers. Know your numbers. Know your numbers. There's also a campaign in Nigeria going on. The Nigerian Cardiac Society has a campaign called Know Your Numbers campaign, which was flagged off last year. I think last year in Abuja was at the flag off. So we are just trying to raise that awareness for people to know their numbers. And I think in the next 4, 5 years, 10 years, we'll still be doing the same, because that's going to be our problem. Infections are not a problem so much anymore. So we're going to be dealing with hypertension for a long time.
Okay, Dr. Atokolo, what are the symptoms of hypertension?
Symptoms of hypertension. Hypertension on its own is called a silent killer for a purpose. It doesn't have clear-cut symptoms. Most people don't have symptoms. They don't have any. They don't feel that they have any problem. That's why it's called a silent killer, because they don't know that they actually have a problem, because they're not feeling anything. Like as I said, most people that have symptoms of hypertension are when their blood pressure are very high, especially at a range of 180 over 120. That's when you start seeing some people begin to present with symptoms of hypertension. And most times, that begins to when you start presenting with those symptoms, you start talking about the complications of hypertension really setting in. Because hypertension on its own is called a silent killer, because it doesn't really show the person that there is something wrong with the person, him or her. So the person feels that everything is okay, no need to check, no need to do anything. So the symptoms the person may experience when the blood pressure is high would include headaches, dizziness. The person may even have chest pain, may have blurring of vision, may have feeling of the heart beating, awareness of his or her heart beating abnormally. The person may experience generalized body weakness. These amongst other things the person may experience. The person may even start experiencing excessive sweating. The person may even experience a reduced urine volume when the person urinates. These are some of the symptoms that the person may experience when the blood pressure is high, and when complications may have begun to already set in for that person.
Okay, Dr. Idoko, also comment briefly on these symptoms of hypertension and give us the risk factors for the condition.
Another point that cannot be overemphasized is the fact that you might not have any symptom. And most people don't have any symptom, like she's rightly said. So it's asymptomatic, no symptom. So that's why you can see somebody who just wake up, we saw him, he had no complaint. He just went to the office and then he slumped. Or he just went to bed, he was well. He just had his dinner, went to bed, and the morning he didn't wake up. So you don't feel anything. So that point cannot be overemphasized. I keep saying this, it cannot be overemphasized. You might not feel anything. So the fact that you don't feel anything does not mean you don't have hypertension, does not mean you don't have a cardiovascular disease. But then she's already mentioned abnormal heartbeats, headaches, poor inability to sleep, leg swelling, difficulty in breathing, of course, inability to use a part of your body. Those are all complications now that can arise. So, but then you might not feel anything, and most people will not feel anything. Maybe when they're feeling something, there's already a problem. Just like the kidneys, you might not have a symptom of kidney disease until more than 70% of the kidney is gone. Same thing with the liver. So those are strong organs. So when the thing is just no complications, you might not have anything. And when you feel something, maybe you're even lucky. So that's the reason why people have to go out of their way to really know their numbers, to check, and then to act based on it. Then it's important to note that in 9 out of 10 cases, or in 90% of cases, the cause of hypertension is not known. So there is no cause. You can't find the cause. So generally we have 2 types of hypertension. We have the primary hypertension or the essential hypertension, which is responsible for 90% of cases. No cause. Only risk factors you can identify. Then in 10% of cases, you have secondary hypertension. And in that case, you can find the cause, which you can correct. If you correct that, then you can, the blood pressure might disappear. So the secondary causes now, which is responsible for a minority of cases, but the leading cause around there will be kidney diseases, kidney infections, chronic glomerulonephritis, inherited abnormalities in the kidney like polycystic kidney disease. Those are inherited abnormalities. Then of course there are drugs that can increase your blood pressure, steroids, There are some persons who have arthritis, joint pains as they age, and then they take a lot of drugs, some drugs to reduce the pain, and some of those drugs can increase your blood pressure. There are hormonal abnormalities that can cause hypertension, hyperthyroidism, Cushing's disease. Those are all hormonal abnormalities that can cause secondary hypertension, which can be identified and corrected. Then, of course, substance abuse, you use cocaine, you use some recreational drugs, those can elevate blood pressure. And when you identify them and you remove them, then the pressure can come down. So those are pheochromocytoma. That's a tumor. It's an endocrine tumor also. Those are secondary causes of hypertension. But majority of people who have hypertension will have what we call essential hypertension or primary hypertension. The cause is not known. So in those cases, you can identify risk factors that can increase hypertension. So the risk factors now, generally for cardiovascular diseases, the risk factors are essentially same. We divide them into modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are risk factors that you can do something about. Non-modifiable risk factors are risk factors you can do nothing about. So the non-modifiable risk factors, age. You cannot do anything about the fact that you are aging. So as people age, go above 40, your risk of hypertension increases. But these days we are seeing it in people a lot younger. So you must not be over 40 before your blood pressure, you have hypertension. But it's higher in people who are aging, above 40. So it's said at the point to be a disease of aging, sort of. But that's not exactly the case now. So you can't do anything about the fact that you're aging. You cannot do anything about the fact that you are a man. So males usually have more hypertension than females before menopause. But after menopause, the risk in men and women equate and even go higher in women. You cannot do anything about the fact that you have somebody in your family who has had hypertension. That's a non-modifiable risk factor. So if you have a family member who has hypertension, your risk of having hypertension is higher. And when if your both parents have it, then the risk is even a lot higher, and you can even have it at a much younger age. Then if you've had somebody who had a stroke, who's had a cardiovascular disease in your family, the risk is also higher. And then of course that points to genetic factors that can also be involved. So those are non-modifiable risk factors. If you are black, hypertension is commoner in black people and it's more aggressive in black people. Even in blacks in the US, it's more in them than the other people. So age, race, gender, family history, those are non-modifiable risk factors. Then you come to the modifiable risk factors. Those are ones you can do something about. So we talk about weight. Weight is a modifiable risk factors. The bigger you are, the higher your risk of blood pressure is higher. We talk about substance use, so alcohol, significant alcohol use, tobacco use, those can increase your risk of having hypertension. Physical inactivity, and that's where we are tending towards these days. So I come out in my car, I park the car just in front of the door, I enter this place, I sit down till 4 o'clock and I go home, which is the lifestyle now. No physical activity, it increases your risk of hypertension. Stress increases your risk of hypertension. Drugs increase your risk of hypertension. So those are non-modifiable. Diet also, of course, also increases your risk of hypertension. So those are the risk factors, and it's a whole long list in addition to this. So modifiable risk factors, non-modifiable risk factors. But even if you have the non-modifiable risk factors, your aging, your family history and all that, you can work on the things that are modifiable to delay or prevent the risk developing hypertension, basically. So just to recap, that hypertension can be primary in most cases, in which you cannot find the cause. So you don't have to say, what have I done that this thing has come to me? I have been doing everything I'm supposed to do and hypertension still came. So the cause is not known. There are genetic factors, salt handling issues and all that. Yes, so, and then the small minority of people, you can find the cause, which you can correct and it will go. But 90% of people have hypertension, you have hypertension and you have to manage it, and it's a chronic illness. So you don't expect, doctor, I've started medication, when will I stop? Well, I just try to say, let's take it a day at a time. But that should be the emphasis. The emphasis should be try to prevent complications by having the blood pressure under control. But most times you're likely to go off the medications because the cause is not known, and basically you have to be managing it over time.
Okay, Dr. Atokolo, when your colleague mentioned family history as one of the non-modifiable factors, for instance, does it mean hypertension could be hereditary?
Yes, exactly. Hypertension could be hereditary. When he said family history, what he meant was, for example, if a person has somebody in his family or a family that has high blood pressure, the person has a higher chance, that's a risk factor, of manifesting hypertension later. And for example, if a person has a parent that has high blood pressure, the person has a risk factor, has a risk of manifesting hypertension later as well. If both parents have hypertension, the risk is even more. If he has any sibling that has hypertension, you say the risk is also with that person. So you see that family history is very important. Even history of parents' family, the father or the mother may not have the hypertension, but someone in their families may have had hypertension which they are not aware of. The people in this present family are also at risk of also having hypertension. So that's where family history is very important in the management of hypertension. It enables the person to be able to know early that he is at risk of having hypertension. So he's going to start early to start modifying his lifestyle. All those, what he said, taking in adequate diet, which includes vegetables, reducing salt in his diet, and increasing physical activity to help prevent or prolong the manifestation, prolong the time of manifesting hypertension in that individual.
Okay, I am really interested in the diet because perhaps it's one of the it's one of the modifiable factors, right? So diet, walk us through how one can limit the chances of coming down with hypertension through diet.
Okay, hypertension coming down, limiting the chance through diet. This would include increasing the consumption of vegetables. Vegetables, I didn't say fruits, I said vegetables. Very important. Increasing the consumption of vegetables in diet. It goes a very long way to prevent not only hypertension but most other non-communicable diseases like diabetes and the rest, because of the part of the things that is contained in the vegetables. Also, reducing salt intake. Some people take very salty meals and they are used to it. Using seasonings that have salt, a lot of salt in it, can also increase the risk of an individual coming down with high blood pressure. So reducing both salt intake and seasoning in food can go a long way to also help the individual prevent the manifestation of high blood pressure. Also, increase water intake. Increasing the intake of water is very important, not only for hypertension, but other non-communicable diseases as well, as it also helps to prevent even diabetes and other non-communicable diseases. It also helps to increase kidney functioning as well. These are some of the dietary aspects a person can adopt to help reduce or prevent hypertension. Also is the reduction or should I say abstinence from some of the diets that have what they call trans fats or altered fats. This will include all these baked products, all these confectionaries. Also, reducing the consumption of those goes a long way to also help reduce the person's risk of having hypertension by reducing or preventing the person's risk of having excess weight or obesity, which, as he rightfully mentioned earlier, is one of the risk factors of developing hypertension.
All right. Dear listener, in case you are just joining us on the program, you've been listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. We are discussing World Hypertension Day, We are focusing on the day to give a sensitization to the public on risk factors, preventive measures, and what can be done to manage the condition of hypertension. Discussants here in the studio, I have with me a consultant cardiologist at the Federal Medical Center here in Makurdi and head of internal medicine at that facility, Dr. Patrick Idoko, is with us. We also have a consultant family physician at the Benue State University Teaching Hospital, Dr. Grace Atokolo. They are leading us on the discussion, and you too can be a part of the program by either sending us a message or calling later on at 10 o'clock. The line for calls will be available shortly at 10 o'clock. Meanwhile, the one for calls, the one for messages is already activated for you to send your contribution or ask questions if you have them. That number for messages and WhatsApp chats is 0912 699 9404 0912 699 9404. If you are sending a message, kindly remember to include your name and the location you are sending your message from so as to enable us to take it. You may also listen to this program and all other programs and content of iGet Radio on www.igetradiotv.com. Once you log onto the website, please check your top right corner, click on the radio icon, and you access our content there live. Also on Radio Garden with any device at all. Once you have your Radio Garden app, you'll be sure to listen to iGet Radio and all other programs. This particular program, Perspectives, is also streaming live on all our social media platforms, including Facebook, YouTube, and Instagram. Kindly search at iGet Radio on these platforms and follow the live stream conversation. Dr. Idoko, are there categories of persons that are prone to coming down with hypertension?
Yes, of course. If we extrapolate from the non-modifiable risk factors and the modifiable risk factors, of course, there are people that are at risk. So it's just like repeating the risk factors again, if I have to say that. So, of course, as you are aging, as you are going more than 40, your risk of hypertension is higher. As a man, as you are aging, the risk of hypertension is higher. Same both male and female. As a black person, the risk of hypertension is higher. If you drink, if you use alcohol a lot, your risk of hypertension is higher. So usually it is recommended that it's what we call significant alcohol use. If a man takes more than 21 units of alcohol in a week, it's significant. If a woman takes more than 14 units of alcohol in a week, it's significant. A bottle of beer, it's about 3 units of alcohol. So if a man takes more than 7 bottles of beer in a week, that's significant alcohol use. If a woman takes more than 5 bottles of beer in a week, then it's significant alcohol use. If you are using spirit, then the calculation is different because the percentage of alcohol is in spirit and wines are higher. If you use tobacco at all, your risk of hypertension is higher. So if you drink, you may have problems. If you smoke, you will have problems. So of course, that's why you have to sell tobacco with a description that smokers are liable to die young. So if you are not active, your risk of hypertension is higher. If you're not physically active, if your weight is much, your risk of hypertension is higher. If your diet is not as it should be, the risk of hypertension is higher. If you use recreational drugs and energy drinks, as is very prevalent these days, your risk of hypertension is higher. So basically, those are the things that put people at risk of hypertension. And it's important to know it's a very common thing. You might not even do anything because your family history is there. It just comes to you, even if you are not doing all these other things. So I see some patients who come and when you tell them their blood pressure is high, they have hypertension, they are angry. They are obviously furious and angry because they say, I've done this, I don't eat this, I don't drink, I don't do this, I don't do that. But then you've still had high blood pressure. So that's why there are some things you can control, the modifiable risk factors. There are those you cannot control. But every human being can have hypertension. Whether you're a bishop, whether you're a pastor, whether you're an imam.
Or you're a doctor yourself.
100%. There are many doctors. In fact, the life expectancy for doctors is even lower because the mental and physical stress of the practice is incredible. I will tell you that. It's incredible. The job is tough. It's not for feeble-minded. I know that every job is tough. Everything that you have to do and do very well is tough, but the stress in medicine, both mental, physical, emotional, I wouldn't tell you to go and do it unless you really want to do it, to be honest, with hindsight. But it's interesting, it's lovely, it's fantastic, I'm happy always doing it. But then it can happen to anybody. So I see some people, the one man came to my office, okay, let's check your blood pressure. He said no, God will not allow him. He believes in God, and so he cannot have hypertension. I said that's not true. Even your bishop, even your pastor, even your general overseer is probably taking hypertension drugs. So as you age, these things happen. Somebody was talking to me, say when he goes for meetings, bishop meetings, he will see people taking drugs. And he was like, how is he taking drugs like this? Plenty drugs. Then as the person is aging, he's now saying the same thing. You have also joined the league like that. So it doesn't spare anybody, whoever you are. But in government house, you are not insulated. That you are in wherever you are not insulated. So even if you are in a developed country with all the best of healthcare facilities, you are not insulated. So it comes to everyone. 1.5 billion, that's more than the population of Africa. People that are living with hypertension. And the people that die from heart disease every year, 18 million. That's close to the population of Ghana. So they are wiped out every year because of hypertension, because of cardiovascular diseases. And the unfortunate thing is that majority of cardiovascular diseases are potentially preventable. They are preventable because if you manage high blood pressure or hypertension, if you manage diabetes, if you manage high lipid levels, if you manage uric acid, they eat a lot of meat around here, so of course uric acid can be a problem here. If you manage all those things, then your risk of having these things are modified or controlled. So there are a lot of needless deaths, a lot of preventable deaths, and that's what is most heartbreaking. So you see people with stroke and all the burden on the family, on the person could have been prevented. You see people cut off in their prime because of blood pressure that just could have been controlled. It's heartbreaking. It's sad. And so everyone has to put his voice or her voice. Everybody has to act as an ambassador. The media houses, the family members, you go home. Tell your brother, your sister, your father, have you checked your blood pressure? Have you done this? Have you checked your sugar? Do you know your numbers? So when people come to me, I don't stop at just managing them, your blood pressure. I ask them, how is your father? How is your mother? How is your sister, your siblings? And for the people that are a bit age, how old is your first child? And then they say 30-something, 40-something. Do they know their blood pressure? So everybody has to do that. That's the only way we can reduce all these deaths. If not, when it comes and the problem comes, sudden death, stroke and everything, everybody, your hand will be inside, your leg will be inside. So
okay. Now, Dr. Atokolo, listening to your colleague, could we factor whether every form of blood pressure, high blood pressure, ultimately leads to hypertension?
Okay. As we said earlier, that for diagnosis of hypertension, you need to have at least 2 separate readings of elevated blood pressure, 140/90 or more. That would now diagnose that person of having hypertension. Some people can have elevated blood pressure, but they do not have hypertension. As we discussed earlier, stimulants, people that take stimulant, that takes all these substance, even all these energy drinks, as we said earlier, bullets and all those things, can temporarily increase the blood pressure. But this, of course, would subside after a while. That's why 2 correct readings of blood pressure that is elevated is needed to diagnose hypertension.
Okay. Now, Dr. Idoko, what are the complications of hypertension? We identified the risk factors. Let's talk about the complications now.
So we are going to re-emphasize them because we've spoken. So hypertension can affect so many organs in the body. 9 out of 10 people who have stroke, it's hypertension that is causing the stroke. So stroke is a leading risk factor, complication of hypertension. Every year there are 15 million people who have stroke. 15 million strokes every year. 5 million would die of those who have the stroke. 5 million would survive, and 5 million will have permanent disabilities. So that's a complication. Dementia, which is memory issues, can happen from stroke. Now I'm taking it from the brain now. Can happen, can be a complication of high blood pressure. The eyes, you can have hypertensive retinopathy and you will not see well. Then you come down to the heart, that's the leading cause of death worldwide. So hypertension, heart failure, heart attack, or myocardial infarction, abnormal heartbeats or arrhythmias. Then, of course, there are still coronary artery diseases, which of course can lead to myocardial infarction or heart attack. Sudden death, which is an important subject of its own. And then you go to the legs, you can have peripheral artery disease, which can even lead to amputation or loss of leg or loss of limb. Then kidney, chronic kidney disease. That's important because the rate at which people are coming down with chronic kidney disease these days is just alarming. And that's a very dangerous disease. Why? Because one of my professors who is in the US now used to say that chronic kidney disease is a sure route to poverty. Sure route to poverty in the sense that by the time the patient has it, then they have to do dialysis or they have to do renal transplant, and eventually the patient still dies. But before they do that, they drain the whole family, not just their own resources, but the resources of all their relatives. And so, and it's potentially preventable by managing hypertension and diabetes. So, basically, those are the most common complications you can have from hypertension, heart attacks, heart failure, sudden deaths, stroke, chronic kidney disease. So the leading complications you can have, of course. And then, of course, it has complications on our pockets too. In the UK, for example, it's estimated that every year there are 1 billion pounds on hypertensive medications alone, not to talk about the complications that arise. So there's a lot of funds that go into these drugs, and these drugs are not cheap. The Federal Executive Council was talking about addressing cost of medications recently. So they're expensive. So what's the minimum wage? And by the time you don't control it and it starts getting severe, starts getting complicated, then all your funds have to go in. And you have nothing left to even eat, have a balanced diet, to even live normally. When you're thinking of school fees, you're thinking of other things. You're not able to go out to exercise. You're not able to buy the kind of food you want to buy. You rather just have snack and cook for how much than to buy a balanced food. So economic factors actually. Managing hypertension is not just looking at the numbers alone. The numbers are important, but we have to look at the economic indices too. When economic indices are bad, then we'll have problem. People living the lifestyle they should live, people getting the medications that they should get, because of course, like we have said, there are non-modifiable risk factors for hypertension. So no matter what you do, people will still come down with hypertension. And when they come down, they have to manage it, and they manage it not with words, they have to manage it with money. They have to buy the drugs, they have to go to hospital. So there is a lot that the government needs to do. As the individuals will have to do their own, and the health institutions will have to do their own. The health institutions, are they even available? And if when they are available, do they even have the minimal resources or materials to check and even make a diagnosis of blood pressure? Even where you have staff, are you training them? Are you retraining them to face the epidemic that is there? When they did the non-communicable study in Nigeria in 1997, they were using cutoff of 160/90 for hypertension. Hypertension has changed now; it has come to 140/90. The Americans have now moved forward to say no, 130. So medicine is advancing, research is coming out, things are advancing. Are you training your staff to be up to date in the management? Are you retraining them? You need funds, you need that. So every stakeholder has to come together. And even the people that are treating, when somebody leaves his house, he has not paid his child's school fees, he has not paid his bills, he comes to even manage the patient, his mind is not even there. So multifactorial factors, and a lot has to be done.
Okay, Dr. Atokolo, are there some of these complications you would like to add, lending your voice along with what your colleague has stated?
Okay, for the complications, yes, spoken extensively on the complications, and even more so on the financial implications. As we can see that even the cost of everything now is increasing. Even the cost of medications too is increasing. So I also wanted to talk about the individuals who said that that they are too young to have hypertension. Like they've been checked. They find that blood pressures are high. They say they won't take medications until later, when they are older, because they're looking at maybe the financial implications. They're thinking they're too young to have hypertension. So it's to encourage that everybody who has hypertension goes out to receive appropriate treatment. And this is also important because if you do not start medications on time for an elevated blood pressure and do not start lifestyle modifications on time, those complications that we've mentioned so far of hypertension may set in. And this time you're going to imagine both the complications. So you're going to spend money on buying medications for the complications. You're also still going to buy medications for the hypertension. So that cost you think you're trying to save would be like times 2 or times 3 of what it would have been if you managed only the hypertension. So this shows you how important hypertension is. So everybody should tell his brother, his sister, neighbor to check, know your numbers. Know your numbers, very important. You should always know what their blood pressure is.
Beyond knowing our numbers, when doctor mentioned that every black person, I was saying, so we all Nigerians are endangered species because our black skin. In any case, we hope our black skin should be insulated from hypertension. But doctor, shortly before we open the line, Dr. Idoko, the Nigerian Hypertension Society, Nigerian Heart Foundation are some of the leading associations with regards to issues of cardiovascular disease, including hypertension. What efforts are you making with regards to getting the government to address the burden of hypertension and other cardiovascular diseases?
Well, the Nigerian Cardiac Society and the Nigerian Hypertension Society, they've been doing their parts. They've been trying to raise this awareness. Even last year, like I said, I was in Abuja for the national launch of Know Your Numbers campaign. So that's a campaign by the Nigerian Cardiac Society to increase awareness about hypertension and its complications and the gaps that they exist in the field of hypertension. We had that launch at Silverbird Galleria. There were a lot of people invited. So I was there, but most people that were invited, they were not even there. They're not even there. The thing is, the government has its own priorities, and if you say HIV program, you will see a lot of investment, you see a lot of people putting in, but then this thing is killing more people than HIV, but people don't show up. I was disappointed at the launch of that program because the interest is not really there. But then you would say that for interest to be there, you have to sell. You have to sell the idea. You have to educate the government and all that. The government are human beings too, anyway. People who form the government. The government for the people, by the people, for the people, ideally. But then the policies are there, even from the ministry. The drive is there, but the support is not really there. So, yes, there's a lot of efforts going on by the Hypertension Society, by the Cardiac Society, but we need government to be willing to back up these efforts with the funds that are necessary and with everything that is necessary. You need a lot. Look at our budget this year, Nigerian budget, 29 trillion. And then you have 1.3 trillion for education and 1.2 trillion for health. And then you have 9 trillion for finance. So how can you develop? Healthcare is expensive. It's an expensive venture. What this is, money has to come in. You are probably doing this for free because you want, that's your part of your corporate social responsibility. But other times you have to pay. I remember when I came to Makurdi newly in 2020, we had World Hypertension Day celebration at FMC. Of course, I had to pay to get one of the media houses to come and cover it. It wasn't something from my pocket, but I had to fund it to pay for it. But so now you need money to do awareness. You need money for treatment. You need money for stethoscopes, for things to check the blood pressure. You need funding for all that. Even that Know Your Numbers campaign that Nigerian Cardiac Society is doing is funded by Omron. Omron is a company that produces blood pressure machine. So our leaders would have to realize that this is something that government has to invest in. The private companies understand this better. So if you see people from maybe the oil companies, for example, their corporate, the healthcare insurance and all that they have is robust. They feel they have invested so much in their staff, they have to keep the staff alive. So they put a lot into their healthcare. But it's not so. I work in the government sector. My health insurance is not so good. National health insurance package is not well funded. It's not well supported. If you go to hospital on national health insurance, there are medications they will not want to give you because the current funding and the payment scheme for the national health insurance scheme, it does not reflect the reality on ground.
Okay,
Yeah.
okay. We open the line soon because we're already up to time to open the line. But basically, comment briefly, is there any such program by the government with regards to addressing issues of hypertension in particular? Is there any government-funded program?
At the moment, nothing specifically. There's a department, there's the Ministry of Health really before now is focused more. Government has focused on infectious diseases, coronavirus, Lassa fever, Ebola. When there is an infection, there's an epidemic, you see a lot of funds pumped out. But there isn't much for hypertension, for non-communicable diseases in general. So that's something, there's a policy on non-communicable disease, but the funding for it is not really there. And I went through the budget for the Ministry of Health for this year. I don't think that's going to change anytime soon because I looked at the budget.
We should interrogate that and to see if what advocacy you as people in the healthcare sector will be making with regards to that as we go along. But for now, let's start engaging with those listening to us. And if you are just tuning in, you've been listening to Perspectives on Agate Radio 95.5 Star FM, Makurdi, Benue State. Our discussion is focused on World Hypertension Day. Our discussants here in the studio is the head of Department Internal Medicine, a consultant cardiologist at the Federal Medical Center, Makurdi, Dr. Patrick Idoko. I also have a consultant family physician at the Benue State University Teaching Hospital, Dr. Grace Atokolo. They are shedding light on the subject matter. And the number 3 which you can reach us is 0814-335-9292. 0814-335-9292. Once you connect with us, tell us your name and where you are calling from. Then you go ahead and make your submission. We appeal that you keep it very brief so as to enable others also have the opportunity of reaching us. Meanwhile, the line for text messages is 0912-699-9404. Hello, good morning.
Hello, good morning, Nathaniel.
Good morning to you. Welcome to the program.
Thank you. I am Corner to do Abraham, calling you at Massey, along Makurdi Radio.
Oh, good to have you join us, Corner to do it. Please, Corner, your radio is close to you. Do us a favor to move away a bit or turn down the volume.
It's okay. I've moved away.
All right, good to have you, Corner. Please go ahead with your contribution.
The doctor said that
Corner, you are still close to your radio, or the volume is still very high.
Sorry.
Yes.
The doctor said the black people are at risk of having hypertension. I would like to know why the black people are susceptible to having hypertension. Thank you.
Okay.
God bless you.
Thank you. God bless you too. We appreciate your contribution, Corner. Your question is noted. We will comment on it as we go along. Please, if once you connect with us, move away from your radio set completely or turn down the volume so we can hear you better. Hello, good morning and welcome to the program.
Thank you very much, sir.
Yes.
I got your guest in the studio.
Yes, my guests are greeting you.
Okay, sir. This is Vincent Ako calling from Wadata.
Vincent, go ahead.
Yes, Vincent Ako from Wadata.
Yes, you are on. Speak to us, Vincent.
Okay. I want to ask Dr. Patrick Idoko, is it true that people living with hypertension are not supposed to walk under heavy sun?
What?
And then secondly, I also want to add
Vincent,
that
people living with hypertension are not supposed to do what? That will lost
to walk under heavy sun.
Okay.
Is it true that people living with hypertension are not supposed to walk under heavy sun? And then secondly, and somebody who is not up to 40 years have hypertension? Thank you very much.
Okay, thank you, Vincent. We'll answer your question. Thank you. All right, questions coming in already, and we would like to hear more of your questions because the experts would like to entertain them. Hello, good morning. Hello. Oh, lost connection with our caller. Hello, good morning, and welcome to the program.
Good morning, all of you there. Good morning.
You would do us a favor. Your radio is quite unpleasant to our communication. Do us a favor to move away from it or turn down the volume, please.
I've moved away.
Okay.
Please, good morning, everybody there. What is the lowest? My name is Okeke from Nima.
Okeke who?
Okeke Alphonsus from Nima.
Okay, Okeke Alphonsus. Good to have you. Go ahead.
What is the lowest? Because I go check my BP. They say it's 111/70. What is the lowest? Because I begin to fear that my BP is too low.
Okay.
Then what causes this for the body?
What causes what?
What causes this? I don't forget to. I'll call you later.
Okay.
Tell me the lowest this thing.
Okay.
I go measure my own. They say now 111/70. What is the lowest?
Okay. Thank you. We answer the question you are able to. If you can't remember, once you remember the other one, if you are not able to connect us, send us a text message. We'll also attend to your question if you remember the second question you wanted to ask. Thank you so much.
Thank you.
Yes. Please, okay, thank you. If you are not able to remember the second question, the moment you recall it, send us a text on 0912-699-9404. 0912-699-9404, so we can entertain the other question you have to. Hello, good morning.
Hello.
Good morning.
Good morning, sir.
Thank you for joining us.
Thank you. I just want to ask.
Yeah, please, before you ask, may we know you and where you are reaching us from?
Okay. My name is Danjuma. I'm calling from Ogule Ogbalu in Nagatu.
Okay, Danjuma who?
Danjuma, Ilyas Aliu Danjuma.
Okay, Danjuma. How is Ogule Ogbalu in Agatu this morning?
Yes, we are doing fine, sir, but Healthline did not let us work in Nagatu here.
God is alive. Please go ahead, Danjuma.
Just a question.
Yes.
What caused this hypertension? That is the only question.
Okay. Are you just tuning in, Danjuma? Did you just tune into your radio now?
Yes.
Okay, because we had spoken about that. But in any case, we'll refresh a bit for you to hear.
Okay, sir.
Thank you, Danjuma.
Thank you.
Yes, thank you. All right. Doctor, let's begin to attend to some of these questions because more are coming in as questions. But we still have people waiting on the line, so we should note them. We'll come to you eventually. Hello, good morning.
Hello.
Good morning.
Nathaniel, how are you?
I am fine, thank you. Welcome to the program.
Yeah, thank you. My name is Alexis, calling from Gwe.
Okay, Alexis, good. Which part of Gwe East are you reaching us from, Alexis?
From Park City.
Alexis, your radio is interfering with our communication.
All right, I get what I'm trying to say is that I want to give my own little bit idea of which the government can see what we can do and how to take care of that blood. One, the government should ensure that there's a unit in the 23 local government. Only a department cannot do that job. We have to start from the grassroots, then get to the secondary and the tertiary. If you're talking about just the tertiary or the secondary, the state, you have to start from the grassroots. The awareness should be there. The health education should be there. So by so doing, people will now understand that blood pressure is what we eat that causes it.
Okay.
On the hypertension, I want to say that on the tertiary level, they've tried. The government are also trying. There's a lot of money there. But who are these people to manage this money we are talking about in the health sector? Well, we have much to say. Thank you.
Okay, Alexis, thank you. Thank you very much. Thank you for your contribution. Please, we would like to appeal very passionately once again that once you connect with us, turn down the volume of your radio set completely or move away from it. That is the only way we can hear you. You will not be interested in speaking to us and listening to yourself on your radio set. That way communication won't happen between us, or it will happen, but it will not really be effective. So we appeal that once you connect with us through call, please move away from your radio set so we can hear ourselves better. Thank you so much. Good morning.
Good morning, Nugget.
Good morning to you.
My name is Godwin Odama.
Godwin Odama, good to have you join us. Where are you reaching us from?
From High Level Makurdi.
Okay, go ahead, Godwin.
Thank you for this program. It's very, very helpful to some of us. My question to our good doctor in the house is this. How often can one have to know his or her number? Is it when go for his checkup? Is it when one is not feeling fine? Or is it weekly or daily? I think so that some of us who are on medication can be able to know if we can be going for this know your number checkup. Thank you very much.
Thank you, Godwin Odama. Thank you for your contribution and your question. We appreciate you. Thank you. All right, Doctor, let's begin. I'd like to begin with you, Dr. Atokolo. Coroner H.O.D had asked us why is it that it's only black men that are said to be prone to coming down with hypertension. Comment about this briefly.
Okay. So, as we spoke earlier, blacks, that is a risk factor for having hypertension. It's not as if it's only blacks that have hypertension, but we are more at risk.
And he asked us why so.
It's more of genetics. It's genetically, yes. It's more of genetics. We've seen through epidemiology, we've done studies, found out that the black race are more prone to having hypertension when compared to the others. That's why the black race is known to be a risk factor for developing hypertension.
Okay.
Because even it's not even in Africa, even those that are outside Africa, those that the black Americans have been seen to have hypertension when compared to their white counterparts living in the same environment. So that's why you say that the black race has a risk factor for developing hypertension when compared to the other race.
Okay, Dr. Idoko, I'm sure that is taken care of, so we may not go repeating the same thing, but let me bring the question of Vincent Accord to you. He asked us whether it's true that people who work under heavy sun are prone to coming down with hypertension, and can people under 40 also face the same condition? Vincent Accord from Wadata had asked us that.
Yeah, before now, it used to be hypertension from the age of 40 and above. But we're seeing a lot of young people come down with high blood pressure. In fact, I have some secondary school people that we give blood pressure medication, and you do all the checks you can, and you really can't find something, except that maybe both parents have hypertension. So yes, these days, age, yes, it's a disease of aging, but it can come in any age now. So you see some patients, I'm 30, why am I having hypertension now? I say, yes, you're even old already, because we see people at a younger age. So that's the transition we are having these days. Yes, it's commoner in people who are adults, but it can also happen in people under 40 years of age. So please, that you are young does not mean you cannot have high blood pressure. So please still know your number. Every adult above 18 years should know their numbers. And even children younger than 18 can also have hypertension. But in that case, you're looking more at a secondary cause, which can be corrected than a primary cause. But yes, every age can have hypertension, but it's more as you age. So that's to answer that. Yes, you can have it under 40. People who
work under the sun, heavy sun.
Yes, are they at risk? Of course, you are at risk, and that might be the reason why some black people around here have more hypertension and more aggressive hypertension, because when you are under the sun, you sweat a lot more, and when you sweat a lot more, your body too tries to conserve salt, it tries to conserve water, so it will retain more salt, it will retain more fluid, and that increases your blood pressure. So walking under the sun, or heavy sun, like he said, it's not good for anybody. So you have to limit your exposure as much as possible. You just have to do it if you really have to do it, because apart from, you can have what we call heat strokes also. So that can also happen from excessive heat. Dehydration can also happen and all that. So it's not too good. Protect yourself if you can.
Okay. Hello, good morning.
Good morning, sir.
Thank you for joining us.
Thank you. I am Ondachi Gabriel from Ondapama, Doctor.
All right, Ondachi Gabriel, thank you for joining us. Please go ahead.
Thank you. My regards to the guys in the house. The doctor in the house explained everything. But what I want to say is this. The government is doing a lot, we know. But there's one thing they still have to do for us. Like people in the rural areas, they are not, if this doctor, this update radio and many other sources from the doctor, we cannot be aware of what is happening with us. After knowing the numbers, we know that we have to treat. But treatment is not by blocking this news and heart. So I want the government to employ more doctors, personnel, qualified ones, more in number in the hospital, so that whoever is affected by this disease can be quickly treated to be well again. If not, if you say you have this number and you are affected by this number, but no treatment, that is nothing to us. Please, I want the government to help us by recruiting more number of personnel to help us in our society.
Thank you.
Thank you.
Thank you. Thank you very much for your contribution. Okay, Dr. Atokolo, OKK Francis from Yima, what is the lowest BP? That was his question. Let's respond to OKK.
The lowest BP. So I think what he's talking about is the normal range of blood pressure.
That's how we should interpret this question. Yes.
So normal range of blood pressure should be between for systolic blood pressure. We discussed what systolic and diastolic means. So systolic is the upper value. So that should be the range between 100 to 120, while the diastolic should range from 60 to 80. That's actually supposed to be the normal range. So when we talk about the lowest, we're talking about 100/60. 100/60. That's supposed to be, if you have a blood pressure of 100/60, that's still normal. So when you start having blood pressures below that, having blood pressures of 90, 80 something over maybe 50 something, that's worrisome. It shows that there is a serious problem. Such a patient should be in the hospital or taken to the hospital immediately, because it means that the person's blood pressure is very low. And conditions in which we have those low blood pressures need to be managed in the hospital. Not very good.
Okay. All right. Hello, good morning. Hello. Yes, I get is responding.
Thank you very much. My name is Kenneth. I'm calling here in Makurdi, Central Bank Quarters, Opposite Scholarship Board.
Okay, good to have you join us, Kenneth.
Thank you. My greetings to the lady and the gentleman in the studio.
Yes, I'm responding on their behalf as their spokesperson here.
Okay, thank you very much. Yeah. Yes. I think you said all, and a lot has been happening. But In our society today, in a country like Nigeria, Benue, government take position of so many things. When it comes to issues of health, government take almost 100% positions of everything that has to do with health sector. That's why I have to fall back on the government. That's the reason why you see a lot of callers talking about government should do this. Yes, notwithstanding, but I would still, advise, or rather suggest that the people who are in the health sector, who are doing well out there, who have the knowledge, of course, who are touched by the spirit, should try as much as possible to do a lot in their communities, in our villages, because a lot of people have zero knowledge about the health in our country, what you need to do to your body, what you need to keep your body to be healthy to some extent. So if you are a medical practitioner and you're doing well in the profession, try as much as possible and give back to the society. Try and go to your own local environment, because as we speak today, if you go to the rural environment, it is as bad as people talks about today. It's real. Primary healthcare centers in a rural environment are grounded. Most of them are not working. Just imagine somebody moving from Dagba or from Betse coming to Tsar, as a Vandika local government. That's a distance. It's about more than 10 kilometers. So those healthcare centers, we should be able to, upgrade them. If people who have enough, we cannot just talk about government only, because when you talk about the government, it has to do with the process. And then our advice here strongly that Federal Ministry of Health, in conjunction with the states and the primary healthcare agencies, they should be in synergy. They should be in collaboration. They should work together. Work with the media in sensitizing people. Today, there's there's no community you go and you don't listen to radio station. We have community radios. If they work, just like you people come on radio today, if the government, through a lot of people, and then has to sponsor this, the radio stations, the televisions, and the rest of the media, society has to put this thing up. I think you will do a lot of good. What you're doing on radio, I must commend you. It's quite a great job, because a lot of people get to know, have a knowledge about how they are going to manage their health. Thank you very much, and God bless all of us.
Thank you very much for your contribution, Kenneth. We appreciate you. Thank you. All right. Okay, Dr. Idoko, Godwin Odama from High Level, how often should one know his or her numbers?
Yeah, there isn't a particular number really, but it depends on your risk. It depends on whether you are taking medications already. So if, for example, I have family members who have hypertension, then it means that from time to time I should check. Once in 3 months, once in 6 months, once in a year minimum. I should have my blood pressure checked, my blood sugar checked, if I have that risk factor. If I have blood pressure already and I'm taking medications, then it's easy to fall into that temptation, that trap of I am taking drugs already, so I am fine. It is not so. So when you are taking medications, you need to still be followed up, because blood pressure management is titration. When you say titration, it's not like chemistry for science students.
Yes.
They are titrating. So you move it up, you move it down, depending on the number. So the number is very important. So today you come, your blood pressure is 190 or 200, and then I give you 4 medications. If you continue that 4 medications, your blood pressure is 100/60, you're still taking those 4 medications, you will just slump one day because the pressure has gone very low. So I need to see you again, and that will depend on the person who is seeing you, and then know how to adjust the drug. If I give you 2 medications, if it's not controlling, I can increase to 3. If it's well controlled, I can maintain it that way. If it's coming too low, I can reduce. So we keep titrating the medication that way. If you are very stable, I can see you once in 3 months, I can see you once in 6 months, depending on how good and stable I think your pressure is. If you have not achieved that good control, I can see you once in 2 weeks, once in a month, and all that. So all that goes to how often should we check. But it's not good to just sit down and check by yourself. So you go to a healthcare worker and they check for you, and then they can determine what to do. So yes, there are a lot of doctors managing these things, but even because of the sheer number of people who have high blood pressure, the doctors alone cannot manage it. So now the Nigerian Cardiac Society has developed what we call the hypertension school, where we try to train even people who are not doctors, pharmacists, paramedicals, on knowledge of hypertension and how to, because it's overwhelming. Like one of the callers said, in the villages you don't have anybody. There are local governments and maybe you don't even have a doctor at all. And that's a very big local government with plenty human beings. So we need to get other people involved who will manage hypertension.
Okay.
But in any case, it's also encouraged that if you have high blood pressure, try and get a digital machine.
All right.
Yeah.
Thank you for holding on. It. Good morning. Thank you for holding on.
The people in the studio, good morning.
Good morning.
My name is Matthew Ajayi Kume. Please, I want to ask.
Matthew Ajayi Kume, where are you reaching us from?
I'm coming behind David Faith Church, Naka Road, Makurdi.
Okay, that's good to know. Please go ahead, Matthew.
I want to know the cause of low BP. And I also want you to explain to me what is the meaning that a lower BP is more dangerous than the higher BP. Thank you very much.
All right. Thank you, Matthew. Thank you. All right. Dr. Atokolo, let's begin with Matthew here. And maybe we should go back to refresh Danjuma earlier. He asked us what causes hypertension. It was a broad question. I'm sure he may have joined in the course of it. Just give a few comments so that Danjuma earlier will follow along with us. Then we'll go to Matthew's question, Dr. Atokolo.
Okay. So for the cause of hypertension, as we earlier discussed, hypertension, we have the primary and the secondary hypertension. The primary hypertension does not have a cause. The cause is not known. That's where risk factors come in. But for secondary hypertension, we discussed that could be caused by renal problems, renal diseases, could be caused by hormonal diseases, it could be caused by medications in which we take. It could also be caused by substances in which we are taking, which will include energy drinks, cola nuts, those relative stimulants in our environment. But the primary hypertension, which is the most common hypertension that we have, about 90% of people with hypertension is primary. And so this one doesn't have a specific cause. The cause is unknown. So that's where risk factors comes in. So that's where the risk factors, as we discussed, we had the modifiable, non-modifiable risk factors. So this included the age of the person. We talked about the race, which is the black race, which is a risk factor. We talked about the family history, that's genetics. The person has family history of hypertension. The person is at risk of also developing SIM. So we also talked about the modifiable, as the modifiable, which we included the people with excess weight, overweight, obesity. We talked about other risk factors like diet. People taking plenty of salt in their diet.
Okay, I think that's elaborated. It's just a refresher. So Danjuma Elia, I'm sure you will tag along with us now. Let's go to Matthew Ajayi myself. The question, low BP, is it more dangerous than high BP? And what causes low BP?
Okay, so as the low BP, and both low BP and high BP are dangerous depending on what the presentation of the patient. Because for low BP, most people who have low BP would experience loss of consciousness, would experience other problems, like may have a higher pulse rate, they may have fever. Most people who have those low BP would usually be rushed to the hospital, because most times they may present with unconsciousness. So, but people that have high BP is not as if the low BP is more dangerous. People that have high BP too also stand in risk of developing things like stroke, depending on how high the blood pressure is, can develop stroke. And even this stroke, we have different types of stroke. We will not go into that. But even stroke on its own is also a serious complication. Even high BP can also cause what we call the heart attack, as we discussed earlier, sudden death in an individual. So even high BP is also an important presentation, just like the low BP as well. So the cause of low BP. Low BP usually would result from the type of low BP which the person has to rush to the hospital. The person will be having an infection which has spread all through the body. that is one of the commonest cause of low BP. It causes mostly in the elderly people, That's why it could lead to unconsciousness, in these individuals. So other causes of low BP, you could have shortness of acute loss of blood. People who are in accidents, accident victims who are bleeding, could also have acute loss of blood leading to presentation of low blood pressures.
Okay, so Matthew, I'm sure we have attempted to respond to your question and you have insights on it. Hello, good morning.
Good morning, presenter.
Thank you for joining us.
There's a voice of Mark, the father who is good from the Goloko government.
Okay, Mark, go ahead.
Thank you so much. Thank the guests in the studio. They have all spoken well. But my question, the first question is that this blood pressure has age limit before one can be affected on it. If it's age limit disease, I may like to know.
Okay,
and the second one, I may like to ask how the government is doing. As a disease, I don't know whether there is a plan to have a vaccination so that those who are yet to be affected will be vaccinated. And the awareness creation in the rural area need to be created. I really want.
Hello, Mark.
Hello.
Yes, you're on.
Complete. Yeah, so I really want to appreciate the contribution made by Kaneken.
Okay.
The rural area need to give attention on their radios. That even on radio is one of the sensitization and awareness creation.
All right.
So they should also go ahead and live with the rural community so that in terms of involving the traditional entities, the community or awareness creation. Thank you.
Thank you, Mark. Thank you. It does appear you joined us in the middle of the program, but Dr. Idoko, age limit, just pointedly, we have answered that again.
There's no
and
age
again.
limit, actually.
So awareness in the rural areas, maybe, and vaccination. He mentioned to vaccinate is hypertension. Does it have anything to do with?
So you usually vaccinate infectious diseases.
Okay.
Diseases that can be transmitted. Like that, not non-communicable diseases. So
yes.
We don't talk vaccines in non-communicable diseases.
All right. So Mark, you are told that hypertension is non-communicable, so there is no vaccination for it. There's that hypertension is not prevented through vaccine. That is the question from the expert. Hello. Good morning.
Good morning, presenter.
Good morning to you, and welcome to the program.
Thank you. I'm speaking with Harry Desmond from North Bank, Makurdi.
All right, Harry Desmond, go ahead.
I want to make an appeal. If this program can be translated into local languages to enable our people in the village there because some of them may not understand all this grammar that is being spoken over the radio. But if they translate this program to different languages, it will help our local people in the local area there to also be beneficial to this program.
Okay, so Harry Desmond, what language are you? Because if we are to translate in local languages, it means we have over 250 local languages.
Like in Benue, the major language like Vidoma, they can also translate this program to the local language to help a lot.
Okay, okay, thank you. Could that be all from you, Harry?
Sir?
Could that be all from you?
Yes, sir.
Thank you for your contribution.
Thank you very much.
All right, thank you. Anyway, all our platforms, our programs are also open to sponsorship. This is part of our corporate social responsibility and sensitization that we are doing. So if anybody is interested, the societies, public persons are interested to come and assist us by our airtime to get the people sensitized in all the languages, of course, we will be willing to do that. We are open to business. Hello, good morning.
Hello, Chief Nathaniel. I put you and your guests in the studio.
Kindly delete the chief.
Yes, I've done that.
Okay, thank you. Thank you for deleting the chief. Go ahead. What's the name and where are you reaching us from?
My name is Osman Nongu. I'm calling from Makurdi, Benue City.
Oh, thank you, Osman Nongu, for joining us. Which part of Makurdi you say you are reaching from?
Modern Market Road.
Okay. Go ahead, Osman.
Yes, last night I felt somehow, and I checked my BP last night. It was 104. So I was confused whether the 104 is low or it's high. But now I get to know that when it's 100, from 100 to 130 to 135, that is not bad. So that's what I did last night. Then that is advice on television that if you are BP patient, that you should be using vegetable, that is ugu vegetable. I don't know how they call it in doctor's slang. Ugu, that vegetable makes your BP to be stable, to be stable. That it will not be high, it will not be too high, and it will not be too low. So I want to confirm it from the doctors in this video. Thank you so much.
Okay, thank you, Osmond. We'll get the doctors to respond immediately. Thank you. Okay, Dr. Atokolo, you are a family physician. Diet. You listen to Osmond. Go. As a family physician, respond to his concern.
Yes, as we discussed during the program, we said that for diet, that vegetables is very important. Ugu is one of the vegetables in which it's recommended. We recommend vegetables, spinach or greens, vegetables. As I said earlier, it helps to control the blood pressure because of its properties. Helps in controlling the blood pressure. These are like lifestyle modifications, diets that you could do, that you should do, even if you're not a hypertensive patient, to prevent hypertension. If you're hypertensive, it's part of your treatment to do this diet. So ugu is one of the vegetables. Yes, it's a vegetable, and we recommend vegetables to all patients, both hypertensive and even non-hypertensive patients.
All right. So Osmond, the doctor has approved your therapy, your diet therapy. Is that an approval?
But it should not be the only therapy.
It's not the only therapy.
Yeah, because that's a mistake that some persons make. Somebody will have a blood pressure of 190.
Yes.
And he wants to do diet and exercise and lifestyle. So there is an extent to which physical activity, an extent to which diet can reduce the blood pressure. So if you do a Mediterranean diet, for example, or what we call the DASH diet, which is a low-calorie, low-fat, low-sugar diet, high-vegetable diet, it will reduce your blood pressure by about 8 to 15 millimeters of mercury. That's what it does to the blood pressure. So if you have 160 or 170, if you take even the maximum, which is about 15, that diet can reduce, it will have left somewhere around 150. So even from science already, it means that diet alone cannot reduce your blood pressure. So somebody who is on stage 1 or grade 1, like 140/90, maybe that can help. But for somebody who's already on 160, 170. So yes, we are saying 2 recordings for blood pressure diagnosis. But if you have a patient with 180/110, you start the patient on drug on that day. You don't wait for that second reading, because that's severe elevation. So at the same time, I can have severe elevation and just go for only diet. Physical activity will reduce the blood pressure by about, exercise will reduce by about 8 to 20 millimeters of mercury. So if you look at that, depending on the level of blood pressure, look at it. Exercise will not do this alone. But so you basically, then alcohol reduction can reduce by 6 to 8 millimeters of mercury. Tobacco smoke cessation can reduce by about 8 to 10 millimeters of mercury. So you factor all that in. So basically for treatment for every patient, you do what we call non-pharmacologic management, which is what the diet, the physical activity and all that. Then you do the pharmacologic, which is where you use drugs and all that. For every single patient, they go hand in hand.
All right.
Yeah.
Okay, so Dr. Nongu, we have even, the doctors have proposed more therapies than even the vegetable you were asking, so I hope you will take note. Hello, good morning.
Nathaniel, good morning.
Good morning to you.
Yeah, my name is Mr. Justin. I'm calling behind Commissioner's quarters.
Okay, Justin who, please?
Yeah, Justin Webe.
Good to have you join us, Justin Webe.
Yes, by regards to Dr. Idoko and the rest of his team.
All right.
Yeah, the program you brought today is a lifesaver. That is what I refer to it.
To God
because I visited a pharmacy yesterday, and you discovered that because of the high cost of consultation fees in the hospital, people have resorted to pharmacy to access face aid and medical assistance. So this program is educating. Supposing I went to the hospital to see Dr. Idoko to get this information he is bringing on radio, I'm sure he would have charged me so much for consultation fee. But there you have him in the studio and he's giving us this information for free. So my concentration here is on the topic of today's discussion.
Yeah.
When you say know your numbers, we are knowing this idea of knowing numbers, as important as it is. A lot of people can't know their numbers because they can't afford to have access to the machines that can even give them these numbers. For instance, you go to a pharmacy and you want to know and check your BP, for instance, you have to pay a particular amount of money before you can even know these numbers. Some of them you need to go to the lab to know these numbers. And because of the economy, the government has to do a lot to help the average person to be able to know these numbers and then maintain the health after that. So I want to once more thank you for bringing this program and for the team in the studio for doing a wonderful job as they explained.
Thank you.
Have a wonderful day in the studio.
Thank you, Justin. Have a great day too. Thanks so much. We are really encouraged by your kind words. Thank you. We appreciate you. Let's take a few messages before we come back. This one here says, is normal BP a fixed figure or a range based on age? This is Jerry Uhange, New Kanshio Layout in Makurdi. Jerry, thank you. We'll respond to your question shortly. Another one here says, this is Veyo Teso from Welfare Quarters, Makurdi. Please, I don't really understand what you mean by know your number. All right, Dr. Idoko, know your number. What does it mean? Briefly.
Well, know your numbers. It's to know your important health numbers. So the last time they were doing presidential election in the US, Trump was like, his numbers are out and this is his cholesterol, this is his blood pressure, this is his weight, he's slightly overweight and all that. So the same thing, know your important numbers, know your blood pressure, know your blood sugar, know your weight, know, of course, your BMI, body mass index, is weight and height, know your cholesterol levels, your uric acid levels. Those are far-fetched, but importantly, blood pressure, blood sugar, weight, those are things we should know. Know them and keep knowing them.
All right.
Yes.
So, Veyo Teso, your question is answered. Dr. Atokolo, is normal BP a fixed figure or a range based on age? This is from Jerry Uhange. He asked us the question. Please respond to him briefly.
We discussed here that the normal BP is a range. We talked about a range of 100 to 120 for systolic blood pressure and 60 to 80 for diastolic blood pressure in adults. This is the normal range in adults. So, of course, in children, you expect lower blood pressures. So the range, of course, yes, is based on age. But what I mentioned here, the 100 to 120 over 60 to 80 is the range for normal blood pressure for adults.
All right. So I'm sure you have noted your question is taken care of to Jerry Uhange. Okay. A few more calls, then we'll come back and try to gradually conclude. Hello, good morning. Good morning.
Good morning.
Welcome to Perspectives.
This is Kwaza Vincent calling from North Bank, Makurdi.
Okay, Kwaza Vincent, go ahead.
Hello.
Kwaza Vincent, you are on. Speak to us.
Hello.
Hello, Kwaza Vincent. We can hear you loud and clear.
Yes. My regards to guests in the studio.
Thank you.
Yes, my question is that what causes this low BP, and when it happens, how can you control it? How can you make it normal in human's body? Because sometimes you discover when you go to the hospital and they check, they will say this person is having low BP. So what is the causes of that low BP? And if it happens, what can be done to make it normal?
Okay, Kwaza Vincent, are you just tuning in?
Yes, sir.
Okay.
Sir?
Are you just joining the program?
Hello?
Okay, we have noted your question. We'll respond to it briefly. Thank you. Otherwise, it is almost the same thing we had responded to Matthew Ajay Kumen, but we'll speak on that briefly again so he gets his response. Hello, good morning.
This is Edabauka.
I
get radio and all very beautiful guests in the studio.
Thank you.
Blood pressure, I tell you, I'm not a medical doctor, but I can tell you that there are many stressors. I once visited a doctor and the doctor mentioned the word stressor. And there are many stressors I think they can be considered as therapy. when we design our cities properly, allow, you can hear machines passing by in the place I'm standing here. For every 1 other second, there is a car on Okada making noise, blowing their horns. They are flying as if they are America from China. And I'm telling you, these things are making a lot of elderly people break down in environments that are not well planned, and they are shanties and so on and so forth. So town planning in itself is a therapeutic aspect for our blood pressure. Then, as you know, people have children and so forth, they can have to pay school fees. So if government, good governance, another dimension is good governance. You pay salary as at when due, make sure that you meet the needs, housing needs of people, and so many other things in society, that if they are not available, no matter how many the drugs that people take, they will only become addicted. And sometimes you are hear that some of the drugs, they make people unable to have sex again, and you know what will happen? The people's wives when they see they look at you, they can't come on. So let government look at various multi dimensions that are relevant to bringing down blood pressure.
Okay.
And society, communities should do same. Churches. Don't overpressure people inside church or tithe and offering.
Okay.
Let people dance more and clap so that even in the process of dancing and praising God.
Thank you, Edabauka. Thank you very much for your contribution. We are fast running out of time. Your point is noted, so we appreciate you. We have to leave it at that point with you so we can go along and try to draw our curtains gradually. Hello, good morning.
Good morning. That is okay back again.
Okay. You are able to remember your second question now? Okay.
Now what is the real measure of sugar level? Where you go that is normal?
Okay.
And what is the symptom of ulcer?
Okay. Hello, okay. For ulcer, for sugar level that may be related to hypertension, we will attend to it. But for ulcer, I think it's outside our focus for today. So let's limit to the one on sugar, which could be a risk factor for hypertension or whatever.
Okay.
Thank you.
The measure of sugar.
All right.
Let me know.
Thank you. Okay. And that will be our last call, the one from Okeke. Dr. Atokolo. Earlier on, Kwaza Vincent asked us the same question about what causes low BP and how can it be controlled. Speak on that briefly, then you also comment on the last question by Okeke.
Okay, so the causes of low BP, as we discussed earlier, we talked about, I will say that there are acute and there are chronic causes. So you could have acute, that's what I mean by acute is sudden causes like sudden loss of blood, like accident victims. You could have infectious diseases, especially in elderly patients, which progresses to all over their body, which could spread to all over their body, leading to low BPs. You could also have chronic causes in which someone has low blood levels over a period of time. You could also have low blood pressures from that. You could also have low blood pressures from some kidney diseases or chronic kidney diseases. From chronic that leads to low blood levels, as I said earlier. Can also lead to some low blood pressures. Even some heart conditions can also result in low blood pressures. So how this is managed is to manage the person who has been seen to have a low blood pressure has to present to the hospital and see the doctor, that's a health professional, so that the cause of the low blood pressure would be identified, as the treatment for each of these would be different.
All right. So back to Alphonsus Okeke. He asked us how to check blood sugar that could lead to hypertension. Respond to him briefly.
I think what he's talking about is the normal range for blood sugar.
Yes.
So the normal range for blood sugar, if the person is fasting, a fasting blood sugar, that is just the normal range should be between 3.5 to 5.5 millimole per liter. The person is doing a test between 3.5 to 5.5 millimole per liter.
Okay, so KK, your question is noted. This one, let's take one last message from our WhatsApp box. This one says, hello, good morning, the presenter and the guest in the studio. I sincerely appreciate your program and recommend that government should make checking of BP free in or the hospitals to encourage periodic check. Tule MC from Gado Villa in Makurdi. Okay, Tule, thank you very much for your message. Dr. Idoko, well, this will be parting shots from you. The advocacy on the path of government with regards to funding the taking care management of hypertension. What kind of programs could you recommend for the government to evolve, especially also concerning the cost of anti-hypertensive drugs?
Well, I think the best solution would be universal health coverage. Universal health coverage would be to increase health insurance for all Nigerians. And healthcare, like someone mentioned, is primacy. Government has a primacy of healthcare, so they have to take the lead. And universal health coverage is what we have to go out for. So provide insurance for health workers. At the moment, it's mostly federal staff, some of federal staff that have some sort of insurance, not very comprehensive. But so the state governments can take cue and follow the local governments, the private institution, make it compulsory for everybody. If you're employing somebody, please get them some sort of insurance. So that is something that government can do. Government can make awareness as part of education, awareness as part of what they have to do. Make it very regular, very often, and take it to the interior. There are places I went when I was serving, something they call rural rugged. I went to that village for outreach, and we're like, does government even know this place is existing? So those places have to also be considered. Then the cost of healthcare, the cost of somebody was getting consultation. You can reduce taxes. You can give tax waivers. They give tax waivers to business people to import things. So what about the healthcare sector? You can give tax waivers to hospitals. You can give tax waivers to these drug companies that are bringing in these drugs. You do that and you reduce the costs of healthcare and of the drugs and all that. And then, of course, a lot of funding, grants. So we hear a lot of business grants going out from CBN, going out from government, but they are not going towards healthcare. So healthcare is not a priority. Really, if you look at the government, we can say all we want to say, but when you look at the budget of a government, they say money shows you where the money is going is where you know the truth from. So if you do a budget and healthcare is taking 2%, less than 10%, how many percent? Then it means that it's not really a priority. So we need to, for federal government, I think the priority, what this Benue state government accrued to health in their budget, the percentage is even a lot more than what the federal government did. So we need to increase funding for healthcare. It has to be at least 10% of our budget, at least. And this year, if you look at the federal budget, 29 trillion, 1.2 trillion is nowhere close. So we have to increase funding, we have to increase awareness, we have to increase programs, and then, of course, we'll save more lives and prolong lives.
Okay, Dr. Atokolo, from you, your parting words, especially to the public who may present with symptoms or even non-symptoms of hypertension, and where to avail themselves of treatment or management of such condition.
Okay, as parting words, as we said, the whole aim of this program is to create awareness, know your numbers. So we are encouraging any members of the public to visit the hospitals and at least have a blood pressure check. It's very fast, doesn't take any much time to do, and it's person will know what its numbers are. To encourage members of the public to inform others who have not heard this program. Those are people with this program should inform others around them, their family members, their friends, to please check, know their numbers.
Is it advisable for people to buy the BP machine and check these numbers in their houses without presenting at healthcare centers?
Yes, we would advise that, yes, you could. It's okay for you to buy the machines, but it's also most important for you to be able to interpret the machine in which you are using. You understand? So it's still important for the person to present to the hospital and get proper advice.
All right, this is where we must have to draw our curtains on today's edition of Perspectives, which we discussed World Hypertension Day, spotlighting its risk factors, ways of prevention, managing the condition, and the awareness that the public needs to have. I must appreciate very sincerely our discussants on the program, Head of Department Internal Medicine and a consultant cardiologist at the Federal Medical Center here in Makurdi, Dr. Patrick Idoko. Thank you so much for coming on this program.
Thank you very much, sir. My pleasure.
We appreciate also the insights we had from the consultant family physician at the Benue State University Teaching Hospital, Dr. Grace Atokolo. Dr. Grace, we are grateful to you.
Thank you for having me in the program.
Thank you, dear listener, for being a part of today's edition. Your listenership, we appreciate it. Your contributions through phone calls and messages, we are grateful to you. We're always here because of you, and we'll continue to do our best to serve you. Your health is our concern. We care about you. Agate Radio is the people's voice. I'll be sure that anything that bothers you, we'll spotlight it and give you the awareness on how to go about it. My name is Nathaniel Nongu. Join us on Friday for another edition of Perspectives. Stay safe and God bless you. Goodbye.